Good morning, everybody. Okay, it's 8:30 and I want to be respectful of everybody's time and leave time for questions. So first of all, let me just say thank you so much for joining me this morning. I live in COVID land. I know you all live in COVID land, but I live in it in a little bit different way. And I know there are just so many questions because I hear them all the time about understanding symptoms and when to get tested and what kind of tests there are. So I thought it would be best to just do a little presentation about it. So I'm going to do my part first. Go ahead and put your questions in the chat. And then when I'm done with my presentation, we'll go back to those chat questions, okay? So let me get my screen sharing going here. Should be this one. And I want to go to, no, I want to go to this one. All right. So our topic for the day, what the heck? Close contacts, contact tracing, COVID-19. So I'm going to just talk very briefly about our health and safety protocols, which you all know. Testing, contacts, contact tracing, sort of explain the difference between the tests. Isolation and quarantine, those are the main topics we're looking at today. So as you all are aware and have been doing successfully for 13 weeks, I think it is now, the goal of our health and safety protocols is to minimize the risk and prevent the spread of COVID-19. COVID-19 is being diagnosed in record numbers across the country and here in Buncombe County. So we know that it's out there. What we want to do is the very best that we can to prevent it from coming to Carolina Day. And if it does come to Carolina Day, minimize the spread. So you're familiar with these protocols. I won't read them to you because you all know about them. What I did want to mention was that we look at these protocols like this Swiss cheese model. It's not enough to just do one of these. It's the stacking up of the layers of these different protocols that make a big difference. So you can see that masks are effective, but masks alone are not 100% effective unless you are a healthcare worker and wearing a very specific type of mask. But for most of us, those cloth masks are fantastic, surgical masks, but add the layer of 6-foot distancing onto that, and you've really decreased your risk. And then add an additional layer of gatherings and ventilation, so meeting outdoors more often, hand washing. You can see how all of those things stack up together to prevent the spread of the virus and prevent catching the virus. So I just found this graphic recently, and I think this is a great way for us to frame this conversation and to think about this conversation. These are the 4 pillars in order for us to box this virus in: testing, isolating people who are infected, doing that contact tracing to find out who they've been in contact with, and then quarantining those folks and having them tested. That's going to keep that virus from spreading. So the types of tests, you have probably heard a lot in the news, and maybe yourself have even gone to get a test. There are 2 basic types of tests to test for the virus itself. The first kind is an antigen test, and that's sometimes called a rapid test. You think about an antigen test like the flu test. The result takes about 15 minutes to get the test back. And it tests for viral proteins on the surface of the virus or small fragments of the virus. Now, the concern about using antigen tests is that they're best used for folks who have symptoms and within the first 5 to 7 days of onset. If you have symptoms, getting an antigen test is a good idea, or a PCR test, which we're going to talk about next. If you have symptoms and your antigen test comes back negative, they will often recommend that you have an additional test if you are someone who has been in close contact with someone who has COVID-19, because antigen tests aren't completely reliable. We are hearing some results about false positive antigen tests. That hasn't always been the case. So antigen tests do have some problems with them. They serve a place because they are rapid, but there are some issues with them. So the gold standard test is this polymerase chain reaction test, or the PCR test. That detects the genetic material of the virus. So this is really helpful for individuals who are asymptomatic. You can get the results in the same day or up to a week. It really all depends on the lab, how many tests they're processing, how quickly they're able to process the tests. And another thing to note about the PCR test is that you may continue to test positive for up to 3 months after you've been infected, because that test is still testing for fragments of the virus. It doesn't necessarily mean that you're still contagious and that you can infect anyone else with the virus, but you can continue to test positive. So if you do feel like you need to get a test, there's a great website that's Find My Testing Place. You go ahead through the North Carolina Department of Health and Human Services. You go ahead, you put in your area code, and it will list a lot of different places that offer testing. So my caveat in now understanding that there's a difference between these antigen rapid tests and a PCR test is to make sure that you do a little bit of research about where you're going to get a test done so that you get the most accurate results and moving forward know how to proceed. Some sites will require a screening in advance. Some will even require a telehealth visit in advance, and others do not. Others you just call, you can make a same-day appointment. They may have a brief discussion on the phone about what your symptoms are, but you can always call me. I do hear where people are getting tested and what their results are, how fast they get those results back. So I'm happy to offer some guidance about some of the sites that I know that folks have found to be very successful. So should you get tested? That's a big question for everyone right now. These are some of the common scenarios that you might think of about wondering, should I get tested? And then if I do want to get tested, which kind of test do I use and when do I go and get that test? So let's talk about that very first scenario. I think I might have COVID-19 because I have symptoms. Here is a student symptom decision tree, a wonderful graphic that a member of our COVID advisory board found and that I am now seeing very widely shared. I think this is really helpful because you may have heard that student symptoms, children, and for children we'll say anybody 10 and under may have different symptoms than adults have. And how do you know? Is this a cold? Is this, am I getting the flu? Is this allergies? What is this? So this is a great decision tree, and I am going to send this out to everyone that you can sort of use to try to decide, like, is this something that I need to rush out and either have myself be tested or have my child be tested? I know a lot of you have also reached out to me when your child has symptoms, and we greatly appreciate that. It's very difficult to know. Some of the symptoms kids have are very mild. So having a sense of, okay, my child's got one of these, maybe it's time to just wait and see if they improve. Okay, my child has more than one of those. Maybe it's time for me to call my healthcare provider, and together we can decide, knowing my child's history, what we should do next. So if you think that you might have COVID-19 because you do have some of those symptoms, you can get tested either using that PCR test or that antigen test. Remember, the antigen test when you have symptoms is much better. If you do think you have symptoms, you should isolate yourself from others in your family and wear a mask at home if you can't isolate yourself. You'll notice this little thing in purple at the bottom of my slide. We have asked that if a member of your family is being tested for COVID-19, that all of the members of that family stay home until those results are received. So if you are being tested, we ask your children to stay home, or if one of your children is being tested, we ask the other children to also stay home from school until those results are received, just out of an abundance of caution. If you think you might have COVID-19 because of family members have symptoms, the family member is the one who should be tested, and they have symptoms, so they can follow what was suggested on the previous slide. If you don't have symptoms, wait until you receive their results. and the family members should isolate until they receive their results. One of the reasons for this is that you may end up getting some false positives. You may end up getting a negative test and they get a negative test, and then you've put yourself through the testing process unnecessarily. We really need to find out if that person is tested negative or positive to know how everyone else in the family should proceed. If you might have COVID-19 because you were exposed to someone with COVID-19, there's some really important things to remember in talking about this. For one thing, if you don't have any symptoms, you need to wait at least 5 days before you are tested. You definitely want to quarantine for 14 days if you've been exposed to somebody, but you've got to wait until that viral load builds up in your system in order for those tests to be the most accurate. Now, I know that's really tricky because anytime someone is exposed, there's such a heightened sense of anxiety. You want to run out the next day and get your test, but it may not be the most accurate. You are still going to want to quarantine for 14 days because of your exposure, but let's wait at least 5 days to get tested. Symptoms do develop anywhere from 2 to 14 days after exposure, so it is possible that you might need to be tested again. If you're tested on day 5 and you don't have any symptoms, and then on day 10 you start to develop symptoms, they may want to go ahead and test you again if that first test was negative. Of course, quarantining for 14 days, and if you do test positive, needing to isolate. And again, I'll talk about the difference between those two things a little bit. If you think you might have been exposed because someone in your family was exposed to someone with COVID-19, your family member needs to get tested right away if they have symptoms. If they don't have symptoms, it's like in the previous slide. They need to quarantine for 14 days and wait at least 5 days after exposure to test. You do not need to get tested. You are not the person with the exposure. It was your family member. So find out what your family member's results are before you need to take action. So when is someone with COVID-19 considered contagious? A person who tests positive for COVID-19 is considered contagious 2 days before they develop symptoms, or if they don't have any symptoms and they've tested positive, they're considered contagious 2 days before they test positive. Now, that's very tricky, right? They're asymptomatic. We don't know how long it has been that they've had the virus. This definition is in order for them to do contact tracing. You are most infectious if you have symptoms 2 days before you develop symptoms, and then in the first couple days of developing symptoms. That's one of the things that's making this virus so difficult to get under control, is because people don't realize that they have the virus. And that's why that multi-stage health and safety protocols is so important, because you may be having the virus and shedding the virus and sharing it with people and have no symptoms, not aware. But if you're wearing your mask and staying 6 feet apart from folks and washing your hands, being outdoors or being in a well-ventilated place without a lot of people, you're doing your part in making sure that you're not shedding the virus and sharing it with others. So close contact is being within 6 feet of someone who has COVID-19 for a total of 15 minutes or more, masked or unmasked. And this does not have to be consecutive minutes. You might be close contact if you provided care at home to someone who's sick with COVID-19, or you had very direct contact with the person. They sneezed or coughed or got respiratory droplets on you, or if you spent a significant length of time in a room with poor ventilation and a COVID-19 positive individual. So you may have been more than 6 feet from them, but if you were in that space for a long period of time and there's not great ventilation in that space, that's why you could end up with COVID-19, which is one of the reasons that the governor has recently decided once again to limit the number of people in indoor gatherings. And one of the reasons why restaurants had been closed for such a long time, it's that concern of being indoors with somebody. You're thinking, well, their table is very far from mine. But if you're in that space for several hours, the virus could flow through the air and to you if there's not good ventilation in that space. So the goal of contact tracing, if you think back to that first box it in, the goal of contact tracing is to identify those folks who have been in contact with someone with COVID-19 so that they're not continuing to spread the virus. If I do find out that someone in our community has a positive test, either a faculty, staff, or student, I will notify the health department. And the health department has also notified me in the cases that we've had recently. I have great communication with the health department. I'm very impressed with their contact tracers. I will assist them in the names of individuals at school who may have been in contact with the individual who tested positive. But remember, all of this information is confidential. So if you get a call from the health department, they're not going to tell you, you were in contact with so-and-so and they have COVID-19. What they will say is you have been exposed to someone with COVID-19. And they'll give you instructions about quarantining and when you should go ahead and get a test. And then they'll continue to follow up with you. Are you developing symptoms? Do you need any other assistance? Thermometers, gloves, masks. There's a whole lot that contact tracers are going to do to try to support individuals who have to quarantine at home. I know the state of North Carolina has also put out this wonderful app called Slow COVID NC. You can download that from the App Store. It uses, and I'm not going to do a great job of explaining it. I should have put this on one of our slides. But they use Bluetooth technology to notify you if you've been in close contact with somebody who tests positive, and they do it in such a way that it's completely confidential. So if someone tests positive, they can indicate they've tested positive, and then this app will go ahead and automatically notify folks, which is wonderful because, as we've said, there's asymptomatic folks out there, and if we are not following all our health and safety procedures at school and outside of school, we may not know that we have been in close contact with someone. So let's talk about like that whole close contact piece. This is a little bit of a reiteration of what I was talking about getting tested, but I think the graphics kind of make it a bit more understandable. So in this situation that we recently had in our lower school with a staff member, a student, and a parent of a student. So the teacher and the student have had close contact. The student and the parent have close contact. That person tests positive for COVID-19. They've had close contact with the student. That student was within 6 feet of them for 15 minutes or more during the contagious period. That person who's tested positive needs to isolate themselves from others so that they don't continue to spread COVID. The person who was in close contact needs to immediately go into quarantine and then test after 5 or 8 days. That piece is really important. If they test too soon, they may not get a correct and true result. So what does that other person do? That's that family member of B. Remember, that student and that parent have been in close contact, but that parent was never in contact with the person who tested positive. So that person who tests positive is isolating. That person who was within 6 feet for 15 minutes or more is going to quarantine and test after 5 to 8 days. And that person C is going to wait and find out what B's test results are. So now let's assume we've gone to the next phase. Okay, B tested positive. What happens now? Process sort of starts over again. Now, B is the person who tests positive, and C is the person who was within 6 feet of them for 15 minutes or more. In this case, B was our student, C was a family member. B is going to isolate. Now, I'm going to talk about that a little bit more because isolation is going to be difficult in all circumstances. When we have younger children, it's very hard to say, you need to be in a room by yourself, use a completely different bathroom, and have no contact with anybody in the house. So that's going to affect the amount of time that the individual who is in close contact is going to need to stay in quarantine. But right now, considering our graphic, B tested positive, they're going to isolate. C is going to quarantine and test after 5 to 8 days. And then we just kind of move on down the line. Okay, D is a friend of that parent C. What do they do? Well, B and C have been in contact. C and D have been in contact, but B and D haven't been in contact. So once again, B is going to isolate. C is going to quarantine and test after 5 to 8 days. And that person D, who's a friend of that parent, is going to wait and find out what the parent's test results are. So now to talk a little bit more about this isolation versus quarantine. Isolation separates sick people with a contagious disease from people who are not sick. So to isolate truly, you've got to stay in a separate room away from others, use a separate bathroom, wear a mask if you have to be around other people. You can keep your windows open for ventilation, wash your hands often, don't share household items, don't have dinner with other folks. It's really keeping yourself quite separate. Quarantining is slightly different. That's just going to separate you and restrict your movement to find out if you are going to become sick because you have been exposed to someone with a contagious disease. So quarantine is staying home, watching for symptoms, staying away from others, and then of course getting tested if you do develop symptoms, and obviously if you've been in close contact with somebody, getting tested after 5 to 8 days. So slightly different. Now, remember we talked before about how hard it can be to stay away from other people if you're young. So when you isolate, you can be with others again since it's been at least 10 days since your symptoms first appeared, and at least 24 hours with no fever, without fever-reducing medications, and your other symptoms of COVID-19 are improving. This sort of applies for the majority of the general population that receives COVID. If you have an autoimmune disorder, or if you have been hospitalized, it may likely be more than 10 days before you can be with other individuals. Now, one thing to note is that the loss of taste and smell might linger longer than just those 10 days. If you do not get your sense of taste or smell back after 10 days, but you don't have a fever and your other symptoms are improving, you can come out of isolation. And hopefully your sense of taste or smell will come back within a couple of months. So quarantining for that person who has been exposed to someone with COVID-19, you need to remain in quarantine for 14 days after your last exposure to the infected individual. This is where that isolation piece comes in. So let's say the person in your family is completely able to isolate. They're in a separate room. They're in a separate bathroom. They're wearing a mask if they have to be outside the room. The windows are open. You're not close to them. You've tested negative, but you're staying in your 14 days of quarantine. 14 days is all you have to do. But let's say that individual is a child and you're caring for that child. You can't be away from that child for 10 days because they need care. Your quarantine doesn't start until after their 10 days are over, because during those 10 days, you are continually being exposed to someone with the virus. So in that case, your quarantine is actually 24 days, the 10 days of their isolation plus 14 days on top of that. So that's an important thing to remember if you start thinking about your house and how, if someone develops COVID, if it's possible for them to isolate, how that might work. I know in other countries, what they have done is for individuals who do have COVID-19, they've actually removed them from the homes and put them up in hotels so that they can truly isolate. I know our country has not done that, but there's some interesting things to think about if you want to say, okay, one person in our family will stay and take care of the child, another person will go. Or it's an adult who's sick, okay, that adult, we're gonna go so that you can stay in the house so that we don't have to be exposed to you. Just some things to consider. Again, if we're following our health and safety protocols and wearing our masks and staying 6 feet apart and not gathering indoors and washing our hands, we're not going to have to do those things because we won't have close contacts. But we know that sometimes it's unavoidable because folks are asymptomatic. And again, symptoms may develop anywhere from day 2 to 14 after exposure. Developing symptoms at day 14 is more rare, but it has happened. Again, it's typically by about day 5 to 8 that the overwhelming number of folks, over 90%, if they do develop symptoms, will develop symptoms. Now, I get that pandemic fatigue is real. Trust me, we are all feeling it. What I do want to note is that we're very clear here at school that shame doesn't change behavior. We're all in this together, and that's what we need to remember. It's important for us to remember that our goal, everyone's goal here, is safe in-person learning. So we're all trying to do the best we can to remind ourselves that we want to make choices that benefit not only us and our family, but our other families in our community that we care about. So following those 3 W's, not just at school, but also when you're away from school. Minimize your risk by being selective about how you socialize and who you socialize with. We know people are contagious before they develop symptoms. We know masks aren't 100% effective at containing the virus unless you are wearing an N95 mask. Again, healthcare workers, this is a completely different situation. They have very protective gear that they wear. They're very specifically trained in how to care for people who have infectious diseases. So all of this stuff that I talked about, I'm really talking about for the majority of us in our community. We want to follow those 3 W's to minimize the risk of catching the virus or spreading the virus. Now, I know we're getting ready to come up on some holidays where we have traditionally wanted to get together. I want to just point out that the CDC website, if you type in CDC and Thanksgiving, you're going to come up with a really nice page that talks about some of the ways that you can minimize your risk and assess what your risk is going to be to celebrate at Thanksgiving. And I have to say, I did this presentation with the upper school students last week, and those were the questions that they had. How can we as a family celebrate Thanksgiving? My parents want to do X, Y, or Z for Thanksgiving, and I'm uncomfortable with that. And what I encourage them to do, 1, is remember that shame doesn't change behavior, and 2, have a conversation. Hey, what can we do that will minimize our risk? We are creative people and we know what works. All right, so maybe this year we're going to have our Thanksgiving outside, and the different families will sit at different tables and we won't all stay in the same house together. Or maybe this year we're going to have, just read this the other day, maybe this year we're going to have everybody bring their food to our house, and then we're going to put it in separate containers and let those families pick it up and take it back to their houses, and then we'll have a big Zoom Thanksgiving, and we'll do it that way. Or maybe this year we decide we're going to focus on a different holiday and see if we can maybe at that point do a gathering at that particular holiday. If we have to be indoors, can we keep all of our windows open so that we have good ventilation? Can we make sure that we're very well spread out? I know some of you may be looking at having college students coming home, and many of the colleges are talking about trying to have students tested before they come home. And then when that student does come home, making sure that they stay away from other folks. I know in some places folks may have even been talking about, well, I really want to be with my family, so I'm going to quarantine for 14 days so that when I do go to visit my family, I know I have a much lower risk of bringing the virus. I mean, there's things that we can do. There's a lot we're still learning about this virus for sure, but there's a lot that we do know that is working. So now's the time for questions. So I'm going to stop sharing my screen. I'm going to see if there's anything in the chat, and then absolutely open it up for any of you who might have a question. So in our chat here, I have, let's see. So there was a question about this, the governor's statement that came out recently about limiting the number of indoor gatherings. And I know there is some confusion about well, wait, we're a school and we have more than 10 people in a classroom. And is that, is that okay? So these public gathering restrictions, schools and churches are excluded from those gathering restrictions. And if you remember, one of the things that we are doing is making sure that our students are 6 feet apart and are masked, and our faculty and staff are masked. So there's also been a question about spread, and this is something that we have talked about. This virus is very interesting. I keep seeing more research about why children, and when I say children, I'm really thinking ages 10 and under, why children don't seem to catch the virus as easily, have as many symptoms as adults do, and spread the virus as easily. In the case that we've had recently, the way that we know it was spread from one individual to the next is which individual had it first. And the individual that had it first did have an exposure to someone else with the virus. So that's how we know that they were the individual who spread it to others. It is much more likely that adults are going to spread it to their children. That what I have read is in many of these cases where children have had COVID-19, it's because they're in a household with an adult who ends up getting COVID-19, as opposed to the children bringing the virus home. Okay, let me see here. The next one is talking about our decision to go virtual in the week after Thanksgiving and the week after Christmas, as opposed to going virtual through that entire time. So if you might remember that I talked about symptoms developing between day 5 to 8, that over 90% of folks will develop symptoms, if they do develop symptoms during that time. We want to provide ourselves the flexibility of making decisions going forward while also doing the best we can to have as much in-person learning as possible. Going virtual that entire week after Thanksgiving will allow us the opportunity to see if anybody in our community is going to develop symptoms, and then what kind of decisions we might need to make going forward. There won't be any close contact with individuals at school, to be sure, but if we see that the virus is really ramping up in the community, and we're looking at those metrics like the number of hospital beds available, the number of people who are testing positive for the virus in our community, we may make a different decision, and we may choose to stay virtual that entire time between Thanksgiving and Christmas. But our goal really is to have kids in-person learning as safe as possible. And we know that this is a good compromise between those two that will be safe. It's what our COVID advisory board has initially recommended, but of course we reserve the right to make a different decision should that be the better decision to make. So if you have symptoms, you can get either the antigen test or the PCR test. If you've been exposed and you don't have any symptoms and it's day 5 to 8, it would be best to get the PCR test. The antigen test seems to be best for folks who do have symptoms. I've had a question here about air purifiers indoors. And there's a lot of information about the importance of ventilation. What I have looked at recently with air purifiers is that they're not actually intended for the spaces that we're typically thinking about. So ventilation with outdoor air is best. Leaving windows open a crack. In school, we're leaving windows open, we're leaving doors open. In your house, you can certainly look at your filtration system. What kind of filters are you using? Leaving your windows open if you feel like you need to. But again, you're home. You feel like home is safe. If you're following all of your health and safety protocols, both at school and at home, you feel like you're safe. But in school, based on the size of our rooms, it really is outdoor ventilation and our central ventilation system that's important. Interestingly enough, I know as much concern as there is about airline travel, I know that airplanes have incredible ventilation systems, and the same can be said of hospitals, right? I mean, Those are buildings where there are a lot of people inside. Hospitals are used to that, and they have really good ventilation systems, which is why they're not putting filters in every room. So that's really the focus, is bring in that outdoor air or enhance your ventilation system overall. Let's see. And we talked about open air ventilation, being outside during the, yes. So this is really interesting. You know, we're not used to having our kids be outside all the time. When we are so fortunate to live in Western North Carolina, where we have very moderate temperatures for a great deal of the year. You would be surprised to know that in many Scandinavian countries, they are camping in the middle of winter. They are outside, and it's all about, interestingly enough, this is what I heard referenced yesterday. It's basically sort of the same thing as the Swiss cheese model, right? The Swiss cheese model is you do a variety of things to keep yourself safe, all of those stacked up together. So they said being outdoors in the winter, it's the same idea about layers, right? Is you have to have the appropriate clothing. I've been really fortunate because I'm on some listservs from an international group of school nurses, as well as school nurses across the United States, both public and private independent school nurses. And I have learned a lot from our international school nurses because they returned to school much earlier than we did. And so we were able to see what health and safety protocols they were putting in place that were being very effective. I see many places that have required students to purchase a full-on rain suit. I mean, it is like a jumpsuit that you go in and zip up, and those kids are outside. Now they're under, you know, some kind of tarp, but they're outside all the time, rain or shine. They've all got their suits on. So it's going to require a lot of your help in making sure that your kids' clothes are labeled. For one, that would be great, because then if something does get taken off, we can get it back to you. But that they have the appropriate clothing. And yes, we will try to be outside as much as possible. And if we are indoors, we will try to have those doors open for a period of time every hour so that we can increase the ventilation. Now remember, it's not the only thing that we're doing. We're doing all of those layers together, that masking, the social distancing, the frequent hand washing, the ventilation, cleaning of surfaces, all of those things together are important. And where we find that we can't do as much of one, maybe it's colder and the door isn't all the way open and it's open to crack. Okay, so we're going to really emphasize some of those others then. We're really going to emphasize staying 6 feet apart. And let's see if there are any other families. I know that Thanksgiving is such a big concern. And so I just want to reiterate that we're just asking every member of our community to have the same goal. It's in-person learning. And we know how to do that because we've been doing it really successfully. I would say this is very successful. Yes, we did have cases of COVID at school. We had 3. Out of 500 some kids, we had 3. That's really remarkable and a testament to how our health and safety protocols work. And yes, we want to encourage each other, not in a shaming way, but we all want to be here together. We're all in this together. We want to encourage each other to look at the choices that we're making for our Thanksgiving and decide what kind of risk we want to take and how we can minimize that risk. I am always available for questions one-on-one as well. Please don't hesitate to shoot me an email. If you do, if your child or someone in your family has symptoms and you have questions about that, I'm happy to give you some guidance. Of course, you may also and should always call your healthcare professional if you have more questions. I am not a doctor, so I cannot diagnose. That's not within my nursing licensure, but I can certainly offer you suggestions and guidance. And if you are tested or someone in your family is tested, please let us know and please stay home until you receive the results of your test. Those are the ways we're going to be able to minimize the spread of this and try to get back to that curve being a little flatter and all safe. I didn't talk about the vaccine. I'm hoping that we will have a vaccine available soon. I don't know how long it will take to vaccinate everybody, But I would expect that we will continue to wear masks and socially distance and wash our hands and follow these procedures and protocols for a number of months going into this next 2021 year. So keep it up, breathe. We're doing a good job here. Hopefully we can remember that, even though we're all feeling pandemic fatigue. And I'm going to just give it a sec in case there are any other questions. And if not, this has been recorded, so we can go ahead and share it with the folks who weren't able to be here today. But I really appreciate those of you who are, and I hope it made a little bit more sense of this whole, when do I get tested and what do I do and how do I know who's a close contact? Because those are the questions that I get the most often. I do want to also say that a member of our COVID advisory board is putting together a really lovely cheat sheet about testing, so you'll have something to refer to often when you have a question about that. I do it all the time, so I know it's in my head, but I know for many of you, it's only when it comes up, and then anxiety comes up as well, and it's hard to remember. What did I hear? What kind of test am I supposed to get? So we want to give you those references that you can pull out if you have a question, instead of trying to hold it all like I do, because I do it every day. So thanks so much, everybody. Good to see you. Enjoy the rest of your weekend.